Hi everyone, my name is Isabella. This is a presentation for my healthcare systems and health policy class. Today, I'll be talking about advocating for Medicaid reimbursement for community health workers as a health policy, with my main focus on the future of the policy. This is the outline of my presentation. Introduction, reason why I chose this policy, benefits of the policy to clinicians, some selling points of the policy, final takeaways, and call to action. Let's dive into the introduction of the policy. After a careful analysis of three potential policy interventions proposed in my previous discussion, Medicaid reimbursement for community health workers, expansion of nurse practitioner scope of practice, and subsidized produce prescription programs, I have chosen to support Medicaid reimbursement for community health workers for this assignment. I would move on to explain why I believe this policy is the most impactful, why it's best supports clinicians, and what makes it a powerful tool for advocacy and policy development. Moving on to why I chose this policy. I chose Medicaid reimbursement for community health workers because of its ability to directly address the root cause of health disparities, especially in underserved communities like Fayetteville, North Carolina. Community health workers bridge the gap between the healthcare system and the community. They speak the language of the people. They understand cultural norms and are trusted by those they serve. In communities where chronic disease is fueled by social determinants like poverty, limited access, and mistrust, community health workers play a critical role in prevention, education, and care navigation. Research shows community health workers help reduce emergency room visits, hospitalizations, and even improve chronic disease markers like blood sugar and blood pressure. Programs like Impact in Pennsylvania report a return of up to $11 for every $1 invested. One may ask, why community health workers policy is the best choice for healthcare clinicians? Let's dive in. From a clinician's perspective, this policy helps reduce provider burden while improving outcomes. As a healthcare professional, one of the most frustrating challenges is not having enough time or resources to support patients beyond the clinic. Providers are overworked, often treating the symptoms of chronic illness without being able to address the patient's home life, access to food, or ability to follow care plans. Community health workers extend the reach of clinical care. They follow up with patients at home, offer health education, help schedule appointments, and assist with transportation or housing needs. This leads to more engaged and empowered patients who are more likely to show up, take their medications, and manage their health proactively. Ultimately, this means better patient outcome and less burden for providers. To elaborate further, these are some real outcomes and evidence of the policy. There are proven results from community health workers programs such as lower hospitalizations and emergency room visits, higher medication adherence, health literacy, better control of diabetes, and hypertension. Also, the ratio up to 11:1. To further elaborate, one will wonder what the selling point of this policy is. My strongest selling point for this policy is its triple benefits. It improves health outcomes, it reduces health care costs, and importantly, it increases equity. That is rare in policy. Politicians want lower costs. Clinicians want better outcomes. Communities want trust and access. Community health workers reimbursement addresses all three. What makes this policy stand out for advocacy and health policy development is that it is already being piloted in several states and Medicaid programs. There is data, there is precedent, and there is a growing bipartisan support for expanding it nationally. This makes it both feasible and high impact, and a win-win scenario that can garner the attention of legislators, administrators, and advocacy organizations alike. Moving on to the momentum of the policy. There has been feasibility and momentum in the policy implementation, which includes already reimbursement in some Medicaid programs. There has been support from the community medical service innovation models, bipartisan appeal due to cost effectiveness and easy integration into current community frameworks. Stakeholders of the policy. The key stakeholders for the implementation of this policy are state Medicaid agencies, community health centers, community health workers and training organizations, healthcare providers and administrators, as well as patients and families. To bring my presentation to an end, I fully support the policy to expand Medicaid reimbursement for community health workers. This policy brings care to where it is needed most. This is because it reflects what good health policy should be. Community health workers make healthcare more human, more local, and more effective. It is equitable, effective, and evidence-based. It does not only address the chronic disease crisis in communities like Fayetteville, but also empowers clinicians and patients alike. It's time to prioritize Medicaid reimbursement for community health workers in North Carolina and beyond. I hope this presentation helped illustrate why this policy deserves to be a top priority in future health reform and advocacy programs. Thank you for watching this video. I look forward to questions and feedback in the comment section.